This term can be somewhat confusing. It describes placing a lens implant in an eye when previous eye surgery has resulted in no natural or artificial lens being present in an eye, so-called aphakia. It also includes replacing a previously implanted intraocular lens that has failed in its function. If you have suffered a complication during cataract surgery and you have needed a period of healing before an intraocular lens can be placed, you will know that you require a secondary lens procedure. Without it, your vision will remain blurry and unfocused. The other common reason to require a secondary lens is if your natural lens or a previously placed implant has slipped or dislocated and your vision has reduced. The more common reasons to require a secondary lens are complications of cataract surgery, eye trauma resulting in lens dislocation, or spontaneous lens dislocation due to time-weakened support structures inside the eye. Occasionally, patients are not happy with the power of their implant or the visual effects they get from it, in which case they opt to replace an implant with a different model. There are also some genetic problems associated with a higher risk of a dislocated lens. Secondary lens is recommended if your specialist thinks that you could achieve a visual improvement or relief from troublesome symptoms through having this surgery. You may be offered a trial of contact lenses first, if this is relevant in your case. This helps us to decide if a secondary lens implant will be helpful. There are many types of intraocular lenses in the market which are used for secondary lens surgery. The main question for your specialist to consider and discuss with you is how to ensure that the new lens implant will be nice and stable inside the eye and how it can provide the best vision with the fewest possible problems. Available implants can utilize existing support structures inside the eye, such as the capsule. They can be placed in the front chamber of the eye, or some lenses can be fixed to the wall of the eye, which is called the sclera, or the colored part of the eye, the iris. Depending on the specific type of implant chosen, surgery may take between 20 minutes to over an hour. In order to perform the operation safely, it may be necessary to carry out a vitrectomy, which is a procedure to remove the vitreous jelly from inside the eye cavity. In case of any surgery, you should remain completely comfortable and pain-free, and you will not see the procedure taking place. That the vision will take some time to return to normal, which can be anywhere from a few days to several weeks. Initially, the vision may be worse than when you started, as the eye recovers. You will need to take some eye drops and may require stitch removal at a later date. This can be done quickly and painlessly during a clinic appointment. Your surgeon can advise you what to expect in your specific situation.